Hi everyone. For those of you who don't know me, my name is Dr.Lipsitz, and I've been a resident of Saltair for over 50 years. Currently, I'm the Chief of Vascular and Endovascular Surgery at Montefiore Einstein in the Bronx, and in that capacity, I've had the opportunity to be involved in several hospital planning and action activities around the current COVID pandemic, and thought it might be instructional and hopefully helpful to share some of that experience as well as the experience in my discussions with my colleagues from around the city with all of you. Firstly, there are three major points or concepts that I think are important. Number one, the current situation is very fluid. It's evolving incredibly rapidly. Today is March 30th. What we say today may not be true tomorrow or even the next day. In our meetings, our plans may change even hourly at this point. Number two, this is really something to be taken very seriously and not lightly. It is a very serious condition. It is very serious from an epidemiologic standpoint, and its impact on society, not just medical but economic, is also not to be taken lightly. And the best way to get us back on track is to aggressively control the spread. I'd like to think about this pandemic as a situation where we don't have a cure, but we do have a solution. At the present time, medical care is supportive, but the solutions are societal and civil, and they fall under the categories of social distancing that I think all of you are familiar with. A little bit of background about hospital planning. As you may or may not know, the planning, of course, is time-consuming and it is constantly evolving, and the governor has challenged all hospitals in New York State to expand their capacity, meaning their beds, by 50% and to staff those beds, which means physicians, nurses, and all ancillary personnel. That's a mandate. He has also challenged the hospitals to increase by 100% their capacity, which is a doubling of all beds and staff. New York State Hospital Association, in response to all of this, has actually relaxed some of their regulations around work hour rules for residents and other staff. They've relaxed some of the regulations around direct supervision for physicians' assistants and residents in order to accommodate the anticipated and right now very real need for ancillary personnel and medical personnel to care for the patients presenting with COVID. Our emergency departments are expanding. We have tents set up outside to accommodate the increased capacity of patients. We're opening new intensive care units on an almost daily basis and having to staff those units. You may also know that all elective surgeries have been canceled as of a week and a half ago, and we are only seeing the most urgent outpatient new visits and outpatient follow-up visits. The hospital is essentially on lockdown. There's no visitors except in pediatrics and labor and delivery. And staffing for all hospital employees, doctors, nurses, ancillary and support staffs are in an all-hands-on-deck mode. Not only are we being asked to cover our own services, but everybody is available to be redeployed to assist both with the emergency and medical service care of the COVID-positive patients. And of course, we're constantly trying to secure enough personal protective equipment to protect our providers, which in turn protects patients, because if we become infected or as we become infected, we also can spread the infection to them. A couple of things about the care of patients with COVID that we're seeing, which might not be immediately available to all of you who have access to certainly lots of numbers and information that's on the internet and television. First of all, everyone knows this is a respiratory disease. It's important to know that patients can and do get sick sometimes very quickly. When patients acquire the worst aspect of the respiratory infection and require ventilation, they often stay on ventilators for up to 2 to 3 weeks, which is far longer than a patient might normally stay on a ventilator with another associated respiratory illness. What that means is that patients are going on ventilators, not coming off ventilators, and this is contributing in large part to the backlog of patients and the decrease in ventilator availability that everyone is experiencing. It's also important to note that there can be 2 peaks of severe respiratory symptoms. Many patients will develop respiratory symptoms that can progress to severe within the first several days of having an illness, but there's a second group of patients who have an illness, symptoms which may be mild or may be more moderate or severe even, who seem to be improving and then suddenly worsen again and may require respiratory support. In addition to the respiratory symptoms, many patients are presenting or have as part of their illness myocarditis, which is an inflammation and disease of the heart, which can lead to heart attacks and arrhythmias. Many patients have renal failure and they're requiring dialysis, and hospitals are actually facing a shortage of in-house availability of dialysis machines to support these patients. Patients develop coagulation, that's blood clotting disorders. Patients can develop blood clots which can travel to the lungs and cause pulmonary emboli. The clinical protocols of caring for these patients are actually very complex. They include aspects not only of the respiratory support, but of whether or not to give antibiotics, if you're going to give antibiotics, which ones, and other aspects, including the renal and cardiac that we just discussed. Finally, there's a significant issue around what I like to think about as non-COVID, COVID-related illness and death that is going to be a result of this pandemic. Number one, there certainly is a very reasonable desire of patients to avoid hospitals at this time, but sometimes patients will wind up avoiding care that they would greatly benefit from. The other issue is, of course, a lack of capacity as the hospitals become close to and even potentially overrun. So what makes this situation so dangerous? Number one, this disease is caused by a family of viruses that is known to humans. It's the same virus that causes the common cold, but this particular virus and mutation that has arrived is completely unknown to humans. So there is no immunity that exists in the human population around this. Number two, the spread of this disease, as you know, is by airborne droplets and contact routes. So all of the measures that you know, safe distancing, wearing masks, hand washing, not touching one's face, are of urgent importance. This disease also behaves both like an upper and lower respiratory infection, with the infectivity of an upper respiratory infection and the serious consequences that frequently result from a lower respiratory infection. It spreads rapidly, and the increase in cases is actually exponential and continues to be exponential. So even when you hear that the case numbers are slowing, it doesn't mean they're going in the negative direction. They continue to increase, and they continue to increase at an exponential rate, albeit somewhat more slowly. It's also dangerous because it presents with a wide range of symptoms, from practically asymptomatic to very severe symptoms, and asymptomatic individuals can transmit the virus without even knowing they have it and when they have no symptoms present. It's also important to remember that at this time the flu is still prevalent, the common cold is prevalent, and seasonal allergies are beginning to kick in, all of which really complicates the diagnosis for this particular pandemic. Final note is that there's no age group that's immune to this. Clearly, older patients and patients with underlying immunocompromised conditions are at the highest risk of death, but all age groups are at risk for getting this disease. And in fact, the 20 to 45-year-old age group represents the largest number of cases. I can tell you there are several hospitalized patients who are young, otherwise healthy, and intubated with COVID-19. So what can we all expect, and what can we all do? Firstly, there is some positive news. The recent information coming back from Westchester County here in New York, and also as recently as yesterday from the city of Seattle, indicate that the social distancing measures that have been put into place do seem to be having a significant effect on the slowing of the disease. Our village board, village employees, and first responders are all busy doing the same kind of planning that was required in the hospital. I think it's important to consider some of the eventualities that they have to consider at the present time. Some of those are, what if this pandemic goes into May? April, I think, is a given. What if it goes into June, July, or even August and beyond and through the summer? What preparations are going to be necessary for that? When we have cases on the island, if it hasn't happened already, and ambulance crews need to evacuate someone, how long will personnel and the ambulance be out of service? What is going to be the capacity of the receiving hospitals to which we might need to evacuate patients off the island, and will an ICU bed be available for any of those patients who need to be evacuated? As the population swells, what will happen if there are simultaneous calls? How will those be triaged by the first responders? We have responsibilities to neighboring communities. Those populations will swell as well. And some of these things may seem far-fetched, but I can tell you just a few weeks ago, everyone working in the hospital would have thought the scenario we're in right now was far-fetched, and I can assure you it is not. All of our responsibility to help the village team, to assist in their planning, and to make sure that the village resources do not get overwhelmed. You know, in the medical profession, we have to work very hard to save a life. And if somebody said you could save a life by just staying home, I think we would all take that. At any rate, this is by no means comprehensive. There's so much more we could talk about. There are many great resources out there. I would refer you to the Center for Disease Control, CDC, Department of Health, DOH, the Governor's Daily Briefings, the Johns Hopkins website, and any number of others that provide information around this current pandemic. Thank you for listening. Be well, stay safe, and I hope to see everyone soon.